Hello everybody, this is Dr. Harika working at Vardhan Fertility. So today I'll be telling you about diagnosis of pregnancy. So when should we test for pregnancy and how should we test? What are the ways that we can test or diagnose pregnancy? So first thing and foremost thing is urine pregnancy test, which everybody of us know. There is a urine pregnancy kit which we'll take. We'll put some urine into it and we'll wait and read it after 5 minutes. So whenever you're reading for the test, if there is single line, that means it is negative. If there are two lines, that means it is positive. If it comes positive, is it pregnancy all the time? The thing is, there is something called false positive test. Sometimes it might be positive, the test might be positive, you might still not be pregnant. So whenever you're testing it with urine pregnancy test, make sure that you test with two different kits and see it is positive on both of them. One more thing is, so when should you test? When should you get a urine pregnancy test? Period today, and if you have missed it today, you can get it. You can get a urine pregnancy test done today itself. Next thing is, what if the urine pregnancy test is positive, and yes, you are pregnant. So how do you confirm this pregnancy if not for urine pregnancy test? The other thing is beta HCG, which is a blood test. This beta HCG is a hormone which increases during pregnancy. So this value will come positive as soon as you miss your period, and sometimes even before you miss your period. So this is a blood test. We draw some amount of blood from you and get a HCG report. So any value between or greater than 25 is taken as positive. So if the value is more than 1500, that means we will be able to see your pregnancy even on scan, which we call as discriminatory zone. In case if the value is between 25 and 1500, we might see and we might not see the gestational sac or your pregnancy in the uterus on scan. So in such cases, we do something called beta HCG-W. It means we do a blood test for beta HCG today, we get a value, and day after tomorrow in the same time we take blood again and we say test for the beta HCG. If the value between today and day after tomorrow, if there is an increase by more than 66%, that means it is intrauterine gestation or it is pregnancy which is in the uterus. In case if the value has not increased more than 66%, it means there is a chance of ectopic pregnancy. Ectopic pregnancy, that means the pregnancy is elsewhere, not in the uterus. It might be in the tubes or ovaries or anywhere else. So in such cases, we can only confirm it with a scan. When will we be able to see the pregnancy on scan? At how many weeks should we do? So usually gestational sac will be seen at 4 weeks, but around 5 weeks it will be better visible. And baby's heartbeat will be seen at around in between 5 to 6 weeks on scan. So this scan is a confirmatory test for pregnancy. So whenever you miss a period and you get your urine pregnancy test positive, what all should you do? First thing that you should do is get a scan done as soon as possible to confirm that it is in uterus, and consult your doctor as soon as possible.